Quick note: this is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Quick disclaimer up front: this video is educational. It is not medical advice, and nothing here replaces a conversation with your own clinician. Here's what Mayo Clinic and the CDC actually say about the early signs of prediabetes and the role of HbA1c lab monitoring. According to the CDC, more than 1 in 3 American adults has prediabetes, and the vast majority don't know it. That's the unsettling part. Prediabetes is mostly silent. The HbA1c test is one of the simplest tools researchers and doctors use to catch that silent drift before it becomes type 2 diabetes. So what is HbA1c really? MedlinePlus describes it as a measure of the percentage of your hemoglobin that has glucose attached to it. Because red blood cells live for roughly 3 months, the test reflects your average blood sugar over that window. That's its strength. A single finger stick can be thrown off by what you ate that morning. HbA1c is harder to fake. Mayo Clinic notes that this longer view is why clinicians often use it to screen for prediabetes and to monitor how well diabetes is being managed over time. Here are the numbers worth knowing, and these come straight from the CDC and Mayo Clinic. An HbA1c below 5.7% is generally considered within the normal range. 5.7 to 6.4% falls into what's labeled prediabetes. 6.5% or higher, confirmed on a second test, is the threshold the NIH uses for a diabetes diagnosis. These cutoffs are population averages, not personal verdicts. Your clinician interprets your result alongside your history, your weight, your family risk, and other labs. Always discuss your specific number with them. Prediabetes is famous for having almost no symptoms. But Mayo Clinic and the Cleveland Clinic do list a few subtle signals worth paying attention to. Increased thirst, more frequent urination, fatigue that doesn't match your sleep, blurred vision that comes and goes, and slow healing cuts or frequent infections. The Cleveland Clinic also mentions darkened patches of skin, often around the neck or armpits, called acanthosis nigricans. None of these prove anything on their own. But if several show up together, that's a reasonable cue to ask your doctor about a fasting, glucose, or HbA1c test. The CDC and the NIH both publish risk factors that raise the case for screening: being over age 35, having a parent or sibling with type 2 diabetes, carrying excess weight, especially around the midsection, a history of gestational diabetes, polycystic ovary syndrome, high blood pressure or abnormal cholesterol. Certain ethnic backgrounds, including African American, Hispanic, Native American, and Asian American populations, also show higher baseline risk according to CDC data. If any of these apply to you, research suggests it's reasonable to bring up HbA1c testing at your next appointment. Testing cadence depends on your starting point. Mayo Clinic notes that for adults with a normal result and no major risk factors, screening every 3 years is a common recommendation. If your result lands in the prediabetes range, the American Diabetes Association guidance, referenced by the NIH, generally suggests retesting once a year to watch the trend. For those already diagnosed with diabetes, HbA1c is often checked every 3 to 6 months. Again, your individual schedule is something your clinician sets. The pattern over time tells a more useful story than any single number. HbA1c is durable, but it isn't perfect. MedlinePlus and the NIH both note conditions that can distort the reading. Certain anemias, recent blood loss or transfusion, pregnancy, kidney disease, and some hemoglobin variants more common in people of African, Mediterranean, or Southeast Asian descent, can all push the number up or down artificially. That's why doctors sometimes pair HbA1c with a fasting plasma glucose test or an oral glucose tolerance test for a fuller picture. If your result surprises you, ask whether one of these confounders could be in play. If a result lands in the prediabetes range, the news from researchers is genuinely hopeful. The CDC's Diabetes Prevention Program study found that modest, sustained lifestyle changes, losing roughly 5 to 7% of body weight and getting about 150 minutes of moderate activity each week, reduced progression to type 2 diabetes by around 58% in participants. Mayo Clinic echoes the same general framework. None of this is a guarantee for any individual, and any plan should be built with your clinician, but the evidence base behind those small, boring habits is unusually strong. If you take one practical thing from this video, let it be this. Write down your last HbA1c, if you know it. List any of those early signs you've noticed, and bring both to your next appointment. Ask your clinician what your number means in your specific context, whether retesting is appropriate, and what trend they'd want to see. Mayo Clinic, the NIH, MedlinePlus, the Cleveland Clinic, and the CDC all emphasize that prediabetes is one of the most reversible stages in metabolic health. Catching it early is the entire point of the test.